So the question of when to perform a standard polypectomy or an endoscopic mucosal resection. Endoscopic mucosal resection, or EMR, means that before we use snare resection, we're first going to perform a submucosal injection. That's all EMR really is. And the issue arises for what we call lateral spreading tumors or lateral spreading lesions, which basically is just a flat or sessile lesion that's more than a centimeter in size. So when we see such a lesion in the colorectum during colonoscopy, the first thing we do is perform a careful assessment of the entire surface. The first thing that we're looking for are features that suggest cancer, and specifically what's called deep submucosal invasion. That means more than 1,000 microns or 1 millimeter of cancer has extended into the submucosa. And those features endoscopically are captured by classification systems. One of them is the NICE classification. In NICE, the type 3 pattern, which means that there is disruption of the vascular pattern, is basically very specific for deep submucosal invasion. That's also captured in the Kudo classification, types 5 and 5N. In these patterns, the vascular pattern looks amorphous and disrupted. It's often associated with a change in the morphology, an ulceration or depression. If those features are present, then this lesion is not a candidate for any endoscopic resection, either EMR or even ESD, endoscopic submucosal dissection, because of deep submucosal invasion. And we should just biopsy that portion and send the patient off to surgery. Obviously, those features are relatively uncommon. The next thing that we want to consider is this an adenoma or is it a serrated class lesion? And for serrated class lesions, I like to use a lower size threshold to perform EMR rather than standard polypectomy. And for serrated class lesions, even 10 to 20 millimeters in size, I prefer to perform EMR, certainly for serrated lesions above that size. For adenomas, sometimes between 15 and 20 millimeters, pretty much always 20 millimeters or larger, we'll perform EMR. Again, that just means we're going to perform submucosal injection before we perform snare polypectomy.